During the first 5 years of menopause, women lose about 30% of their collagen. How can your skin be dry and oily at the same time? Welcome to perimenopause. You wake up one morning, look in the mirror, and think, what the heck happened to my skin? It's like someone switched it out overnight. The products that worked for years suddenly do nothing. Your skin is dry, dull, breaking out in weird places, and you're wondering if you're losing your mind. Well, you're not crazy, and you're definitely not alone. Hi everyone, I'm Dr. Weinstein. I'm a board-certified dermatologist. If you're a woman over 35 and your skin has suddenly gone rogue, this video is for you. What you're experiencing isn't in your head, it's perimenopause. And it's wreaking havoc on your skin in ways no one prepared you for. Today, I'm breaking down exactly what's happening to your skin during this hormonal roller coaster and what you can actually do about it. Okay, so let me paint a picture that probably sounds familiar. You're 42, maybe 45, your skincare routine has been solid for years. Then suddenly, I mean literally overnight, everything changes. Your trusted moisturizer isn't moisturizing, your cleanser feels too harsh, you're getting breakouts on your jawline like you're 16 again, but also noticing fine lines you swear weren't there last week. Here is what's really happening. Your hormones are starting their slow decline toward menopause, and your skin is the first to feel it. Estrogen, which has been your skin's best friend for decades, starts fluctuating wildly before it eventually drops off a cliff. Think of estrogen as your skin's personal trainer. It keeps collagen production up, maintains your skin's thickness, helps retain moisture, and keeps oil production balanced. When estrogen starts its erratic dance during perimenopause, which can start as early as your mid-30s, your skin literally doesn't know what to do with itself. One day you have enough estrogen to maintain that plump, hydrated look, and the next day levels drop off and suddenly your skin looks deflated. This isn't gradual aging. This is hormonal chaos, and your skin is caught in the crossfire. Okay, so here's the part that's gonna make you wanna start a skincare emergency fund. During the first 5 years of menopause, women lose about 30% of their collagen. 30%, that's not a typo. But here's what's even more shocking. This process starts during perimenopause, sometimes a full decade before your periods actually stop. So while you're still getting your period and thinking you're fine, your collagen is already packing its bags. This is when your skin suddenly looks different. It's not just about wrinkles, those are coming too. It's about skin thickness, elasticity, and that bounce back quality that made your skin look youthful. When collagen production slows down, your skin literally becomes thinner and less resilient. I tell my patients to think of collagen like the scaffolding of a building. When you start removing pieces of that scaffolding, your whole structure changes. Your skin loses its ability to snap back from expressions, it becomes more fragile, and it starts to sag in places it never sagged before. The cruel irony, this is happening at the exact same time when you're probably dealing with work stress, family responsibilities, maybe caring for your aging parents. Your skin is changing when you can least afford to look tired. So remember when you could skip your moisturizer and your skin would be fine? Those days are over, and here's why. Estrogen helps your skin produce natural oils and retain water. When your estrogen fluctuates, your skin's moisture barrier becomes compromised. But here's where it gets confusing. You might also be breaking out more. How can your skin be dry and oily at the same time? Welcome to perimenopause, where nothing makes sense. What's happening is that your skin is producing oil in response to dryness, but it's the wrong kind of oil in the wrong places. You might be getting oily in your T-zone while your cheeks feel like sandpaper, or you're breaking out along your jawline, a classic sign of hormonal acne, while the rest of your face is flaking. This is why your old skincare routine isn't working. You're trying to treat your skin like it's the same skin you had at 30, but it's not. It's hormonally different skin that needs a completely different approach. I see women in my office every day who are using the same products they've used for 15 years and wondering why they're not working anymore. It's like trying to use a flip phone in 2024. The technology has changed and so have your needs. So here's something nobody warns you about. Your skin becomes more sensitive during perimenopause. Products you've been using for years suddenly sting. Your favorite exfoliant now leaves you red and irritated. Even your trusty sunscreen might start causing reactions. This happens because declining estrogen affects your skin's barrier function. Think of your skin barrier like a brick wall. Estrogen helps maintain the mortar between the bricks. When estrogen drops, that mortar weakens, making your skin more permeable and reactive. I've had patients come in convinced they're developing allergies to everything. And they're not wrong because their skin has become more reactive. But it's not permanent allergies, it's hormonal sensitivity that can be managed with the right approach. This is also why you might notice that cuts and scrapes take longer to heal, or that you're more prone to rashes and irritation. Your skin's repair mechanisms are compromised because they rely so heavily on estrogen to function optimally. So the super frustrating part is that this sensitivity comes right when you feel like you need more aggressive anti-aging products. You're seeing changes and you want to fight back, but your skin can't handle the weapons you use. So if you've noticed dark spots appearing seemingly overnight, you're not imagining it. Hormonal fluctuations during perimenopause can trigger melasma and other forms of hyperpigmentation. Here's what's happening. When estrogen levels fluctuate, it can stimulate melanocytes, the cells that produce pigment. This is the same reason why women get dark patches during pregnancy, but perimenopause can trigger that too. The cruel part is that these dark spots often appear on your face, your forehead, your cheeks, your upper lip, right where everyone can see them. And unlike age spots from sun damage, hormonal pigmentation can be much more stubborn to treat. I've seen women spend thousands of dollars on lightening products that don't work because they're not addressing the hormonal root cause. You can laser and peel and bleach all you want, but if your hormones are still fluctuating, that pigmentation will keep coming back. This is also why sun protection becomes even more critical during perimenopause. Your skin is more vulnerable to pigmentation changes, so that casual sun exposure that never bothered you before can now leave lasting marks. Let's talk about something that really bothers my patients: the change in skin texture. Your skin might feel rougher, look duller, or develop a crepe paper-like quality, especially around the eyes and the neck. This happens because estrogen helps maintain the skin's natural exfoliation process. When levels drop, dead skin cells don't shed as efficiently, leading to a buildup that makes your skin look and feel rough. But here's the tricky part. Your skin is also more sensitive now, so you can't just scrub your way to smoother skin like you might have in your 20s. You need a more strategic approach that works with your changing skin, not against it. I also see women developing what I call texture anxiety. They become hyper-focused on every little bump and rough patch. This is normal, but it can lead to over-treatment, which makes everything worse. The key is understanding that some texture changes are normal and expected. The goal isn't to have 25-year-old skin at 45, it's to live in your healthiest 45-year-old skin possible. Okay, enough about doom and gloom. Let's talk solutions. The first thing you need to understand is that you can't fight perimenopause with the same skincare strategy you used in your 30s. You need a hormonal skincare approach. First, gentle is the new aggressive. Your skin can't handle harsh scrubs or high concentration acids like it used to. Switch to gentler formulations and build up slowly. I recommend starting with lower concentrations of active ingredients and seeing how your skin responds. Second, hydration becomes your best friend. Look for products with hyaluronic acid, ceramides, and niacinamide. These ingredients help repair and maintain your compromised skin barrier. Layer lightweight hydrating products rather than relying on one heavy cream. Third, retinoids become more important than ever, but you might need to adjust your approach. If your regular retinol is suddenly too irritating, try using it less frequently or buffering it with moisturizer. The goal is consistent, not aggressive treatment. For pigmentation, vitamin C becomes crucial, but again, you might need a gentler formulation. Look for magnesium ascorbyl phosphate or sodium ascorbyl phosphate instead of L-ascorbic acid if you're experiencing sensitivity. And please don't forget sunscreen. Your skin is more vulnerable now, and sun protection is your best anti-aging strategy. Look for mineral sunscreens if chemical ones are suddenly irritating. So here's what I want you to understand. These skin changes aren't a failure on your part. You didn't do anything wrong. Your skincare routine didn't suddenly become bad. Your skin is responding normally to major hormonal changes. The beauty industry wants you to believe that the right product can stop aging, but that's not what's realistic or healthy. What we can do is support your skin through this transition and help it to be as healthy as possible at every stage. I also want to address the emotional component of this. It's normal to feel frustrated, sad, or even angry about these changes. Your skin has been a constant in your life, and when it suddenly changes, it can feel like a loss of control. But here's the empowering part. Once you understand what's happening, you can work with it instead of against it. You can adjust your routine, manage your expectations, and focus on skin health rather than trying to turn back the clock. Your skin didn't change overnight because you're doing something wrong. It changed because your hormones are doing exactly what they're supposed to do at this stage of life. The key is adapting your skincare to support your skin through this transition. Remember, perimenopause is temporary. Your hormones will eventually stabilize and your skin will find its new normal. In the meantime, be patient with yourself and your skin. Focus on gentle, consistent care rather than dramatic interventions. Are you experiencing these sudden skin changes? Drop a comment below and let me know what's been most frustrating for you. I read every comment and love helping you navigate this transition. And if this video helped you understand what's happening to your skin, please give it a thumbs up and subscribe for more hormone-friendly skincare advice. Your skin and your sanity will thank you. Remember, you're not alone in this and you're definitely not crazy. Your skin is just speaking a new hormonal language and now you know how to listen. And for more specific skincare recs for perimenopausal skin changes, please check out the link in the notes below.